So welcome everybody to 2022. I'm glad to see so many friendly faces here and some newcomer names on our meeting list. Since this is our kickoff meeting for the year, what I'd like to do is take a quick second just to calibrate on where we are and what we've been doing, and then to try to provide some level setting for what I think we can accomplish here in 2022, working together about what we can do and how we can get there together. OHDSI's mission: we are all here because we are here to improve health by empowering a community to collaboratively generate the evidence that promotes better health decisions and better care. And it's this focus on trying to generate reliable evidence that's actually useful that has galvanized a lot of us to be interested and be part of this community and to try to focus on the individual contributions we can make to this kind of greater purpose. For those that are new, we've been trying to describe the different ways in which OHDSI collaborates. And George published a paper last year that highlighted this particular figure. We have many different modes of collaboration. Within the community, we are collaborating on open community data standards. So for those of you who are here because of the OMOP Common Data Model and learning about how to translate your source data into a standardized format like Melanie introduced with her health systems interest group, this is the place for you. We collaborate on open source development. So for those of you who are interested in developing R packages and other analytic routines to conduct analysis on data, Martijn Schumi leads our OHDSI work group, and we also develop various web applications to conduct analyses, and this is a great place for you to get engaged here. We conduct methodologic research, so we specifically try to design methodologic experiments to develop and evaluate scientific best practices for how to learn reliably from observational data. And many of you have seen the work that we've done, including work last year to support vaccine safety evaluations. And then we collaborate on clinical evidence generation. So we try to identify questions that we think matter to patients and try to generate evidence across our network of data. And so if any of those topics are of interest to you, even just one of them, then this is the right place for you. We also have the world's largest data network as part of our community. The OHDSI Data Network is set up as a distributed data network with data partners who have agreed to be part of this data network by converting their data into using the Open Community Data Standard, the OMOP CDM, and by applying standardized analysis tools to that data so that they can answer questions. Now, because it's a distributed data network, that means we are not compiling patient-level data together in any sort of way, but rather any organization, anybody who has access to patient-level data can participate in any network study simply by adhering to these community standards and standard tools to run analyses. And the third primary way that we actually collaborate together is by conducting network studies. And the way this works is that we pre-specify a protocol with analysis specifications. Those analysis specifications is codified code using our standardized tools. That code is then shared with the data network. Any data partner can opt in to participate in a study by bringing that code securely within their own firewalls, executing the code against their OMOP Common Data Model instance, and sharing back aggregate summary statistics, no patient level data, but just only the answers to questions. And then we collaborate together to interpret the results and disseminate the findings. And so generically, this is how we've conceived of OHDSI as a community of different ways to collaborate and engage. And for all of you that are new on the call, we encourage you to actively contribute and participate in any of these facets. You don't need to be a data partner to be a meaningful contributor. You don't need to be an expert in methods research or to be a world's best programmer. You can make meaningful contributions throughout this space. And indeed, none of us are expert across all of these areas, but rather we're trying to create a community whereby together we can accomplish important public health goals by generating evidence, by bringing all of these pieces together. OHDSI has grown pretty spectacularly over the last several years. Last year, we highlighted very specific numbers of our collaborators as measured by the number of people who have signed up to OHDSI as a collaborator in our MS Teams environment. is now over 2,300. And actually, I just looked at our current tally, and it's actually 2,700 collaborators. It's in 74 countries and 21 time zones. We also have the world's largest data network, comprised of over 330 data sources who have voluntarily told us that they are indeed implemented the OMOP Common Data Model and are using it for their purposes. That's covering over 280 electronic health record systems and 28 claims data sets in 34 different countries, collectively representing over 11% of the world's population in data. Now, these are impressive tallies, and I think it's only going to grow continuously as we evolve as a community. But we're now kind of reaching this tipping point where we need to stop being impressed with what's possible and start translating what we now have into real accomplishments. Instead of being proud of the fact that we've got 2,000 people that have raised their hands to say, I want to do something, we need to think about what our obligation is now that we have 2,000 people raising their hands saying, let's do something together. And if we've got 10% of the world's data standardized, we need to start thinking about what our responsibility is as a community to generate evidence to improve patient care, given that we have this opportunity in front of us. So last year was another banner year for the OHDSI community. We did a lot of great work. As Craig highlighted in the OHDSI newsletter that was released just at the end of the year, I definitely encourage you all to take a look at that if you didn't. We tried to highlight some of the highlights that many of the community had voted for as their top accomplishment of 2021. We had our OHDSI 2021 Global Symposium where work was showcased from around the world. We conducted important vaccine safety methods research to try to develop and evaluate best practices for how to evaluate the COVID-19 vaccines. We hosted the reproducibility challenge and brought people together to think about what it actually means to do reproducible research. We held a Hades unit testathon to actually harden the open source software that we've been working on. We released OMOP Common Data Model version 5.4 as the community data standard that we will be applying across all data partners across our community this year to try to get everybody on the same common platform so that we can really unlock the value of the data we have. We've seen tremendous progress across our Eden initiative, with over 143 data partners signed on to transform their data to the OMOP Common Data Model, 43 small and medium enterprise companies now certified to actually train anybody around the world in how to develop their OMOP Common Data Model, stand up the OHDSI tools, and conduct studies. We published Our Journey, our book that summarizes our community and activities. The Pioneer Initiative held a prostate cancer study-a-thon, which made great progress, showing a kind of a new way to do collaborative research. We made good progress on our Legend Initiative, and under Mark Suchard's leadership, made really good progress in thinking about how we can apply the Legend principles, as have previously been applied for depression and hypertension, now being applied to type 2 diabetes. We held the OHDSI APAC Symposium, and we saw great work coming from across the Asia Pacific region. We had really important work that supported regulatory decisions associated with the COVID-19 vaccines as it related to characterizing the background rates of adverse events of special interest and understanding what it means to use our international data network to understand incidents of adverse events. And we were also able to highlight and celebrate the accomplishments of key contributors across our community, and the Titan Awards was a great way to recognize the great work that has been done across our community. So we had a lot to be really proud of for 2021. The question we have today, now that we're turning the page, is what should we accomplish together in 2022? And so I want to use this time to hear from all of you. And as such, I've created an open poll. I'm going to ask that you post it. And Craig, if you could post it in the chat, and also I'll leave it on the screen here. If you can go to pollev.com/PatrickRyan800, you're going to see a question that will pop up. You can do this on your laptop or on your phone or whatever you want. The question is, what should we accomplish together in 2022? And I really do want to hear from all of you. I'd like for you to post in your feedback Also review inputs that others have entered in. You can upvote or downvote as you see accordingly. And while you're getting there, I'm going to provide a passionate plea for my reflections over the holiday season and try to be maybe a little bit deliberately provocative about why I think the way we do research right now is kind of stupid and how we need to come up with a better approach to doing research that I believe OHDSI is well equipped to tackle. So I see Craig posted the chat there. I'm gonna hope that you guys are getting in. I see now at least one other person has posted something in there, so I'm gonna keep going there. There's one post that I posted in there, and it said, develop a system to generate evidence that characterizes disease and treatment utilization, estimates the effects of medical interventions, and predicts outcomes for patients within a network of observational health databases. And I'm gonna I entered that one in as my own seed into this chat. You're welcome to up or down vote that as you see fit, but I'm going to give you my own personal argument for why I think that this could be a particular important priority for us. So we've used this slide many times, including in the book of OHDSI, to talk about the convoluted journey from data to evidence. That right now it is very much a bespoke journey. Somebody cobbles their way through some windy path from having access to data to going through some process of manipulating that data, coming up with some sort of analysis, performing some analysis, trying to write it up into some sort of paper, putting it out there, calling it evidence, and then having some sort of debates about that one way or the other. And part of the reason we're all together as a community is that we recognize that all of us go through this journey every day, all of us who are in this observational research space, and it's a painful, hard process. And we're not very good at it, frankly. We're slow, we're not reproducible, and many people call to question whether or not actually the evidence we generate truly could be considered reliable. Now, I've been reflecting a lot about what are the problems and what are about some of the solutions about this. And one of the things that kind of hit me to the eyes as I was reading some science in some other spaces was thinking about the process that we follow to do observational research today, and some of the things that might actually on the surface from other domains just be considered kind of crazy. So I'm going to argue that the current status quo in generating in observational research makes it challenging, if not almost impossible, to actually build trust in the evidence. And I'm particularly here talking about where I think is OHDSI's sweet spot, which is conducting non-interventional studies, retrospective analysis of existing observational data. So there's a database that already sits out there. George is sitting on the Columbia University Medical Center data set, or Christian has access to the IQVIA data, or anybody at any institution already has data sitting there. And so the data is available to be unlocked. And yet we conduct research in a very prospective manner. We start by writing a protocol. Sometimes, some of you guys write protocols. Many of you don't actually write protocols. Some of you are obligated and begrudgingly write protocols. Some of you like to write protocols. Some of you hate to write protocols. Many of you don't write protocols. But at least in theory, the idea of a protocol is to pre-specify what you are going to do in your analysis. Now, this idea of writing a protocol is not universally accepted within our field. And I've been thinking about it because it bothers me. I personally have to write protocols for all the work I do. I don't really like it, but I appreciate the value of pre-specification. But I've been trying to understand, why am I so bothered by this process? And I think I at least have a conception of why this would be. Because what I have to do up front is I have to write a document that says, when I get to the data, I hope the data will have the following pieces of information of sufficient quality. And if the data is of sufficient quality and adequately well represented, then I think what I'll do is create a phenotype definition that might find me the appropriate exposures and outcomes of interest. And if those phenotypes are of acceptable operating characteristics, then I think what I'll do is design a particular analysis that might produce unbiased information. And if all those places hold up, then I will have an answer that I actually think would be reliable. And then in that document, I'm going to write a limitation section and say, but all of those assumptions that are untestable assumptions could fall over, and I'm going to have to iterate a whole bunch of other times. And so I'm going to impose an awful lot of subjective belief about what I think might happen in this prospective look into the future about what will happen when I start doing my research. But remember, the data is already in my hand. So this idea that I'm going to speculate about what will happen when I already have the data is a little bit silly. But this subjective idea that I'm going to come up with something right to do and I'm going to write it in a protocol is where many of us have to start. Some of you all who get away without writing protocols just do this in your head, I suppose. Now, some of us have an even bigger hurdle to have, which is we have to have other people review our protocols. So in addition to my subjectivity about my beliefs about what might happen with the data, what might happen with the phenotypes, what might happen with the analyses, I got to then give this human English free text document to some other human who's then going to impose their own subjectivity to the process. And they're going to decide what do they think is going to happen to the data? What do they think is going to happen to the phenotypes? What do they think is going to happen to the analyses? And then they're going to opine on their own opinions about this proposal. And you're going to go round and round speculating and guessing about what's going to happen in the future. And only after you go through that process, if you guys bother to write protocols, which many of you don't, then you get to go through the process of curating the data. You get access to the data, you extract out the relevant information that you need. You go through the process of selecting your cohorts, defining your phenotypes, and thinking about the definitions that you want to apply. You implement some sort of analyses that are going to generate the summary statistics that you're interested in. And after you've followed this pre-specified approach, curated the data, created the cohorts, implemented the analyses, then you're going to disseminate the evidence. And at that point, you give a English free text document called a publication to some third human or a set of humans who are then going to read the information that you provided, and they're going to ask a question, which is this evidence reliable? And when you hand that document to those reviewers, they are already biased because you have not only given them the what you did, the method section of your publication, but you've given them the results. You've told them the answer to the question that you thought you would have said. And at that point, only after you're done with the process, does this reviewer actually ask the question, well, did you ask the right question? Did you follow the right steps? And do I actually trust the answer that you provided? All with full sight of what that answer actually is. And there's problems that at that the last step of the process that a reviewer legitimately could have. There are methodologic concerns. So they may be concerned about the fact that your methods may be biased. So your protocol assumed that you had some unbiased approach, but how'd you actually prove that that was true? There could be concerns about measurement error in your phenotypes. Your protocol said that you hoped that you were going to have good operating characteristics, but how'd you prove that? There could be methodologic concerns about data quality. Your protocol would say, we hope that we've got good enough data quality standards, but how'd you prove that? And then there's also technical concerns that a reviewer should be legitimately concerned about. And I'd actually assert isn't concerned enough. There are concerns like, is the programming code actually correct? Is the logic for your phenotype actually correct? Is your ETL that transformed the data manipulated in whatever form, is that actually correct? So there's legitimate questions about, does the study actually provide an unbiased estimate? Are the findings generalizable to population? Those are scientific questions. But then there's also very real questions about, can a study be fully populated, fully reproduced? And does an analysis actually do what the protocol said it was going to do in the first place? And many of you got to participate in our reproducibility challenge last year, where we went through this process and revealed that this process, if we go through this bespoke, manual, custom, step-by-step process, it is nearly impossible for us to actually faithfully follow this process and get objectively correct, reproducible, consistent results. And so the reason why I suggest that we need to think about developing a system is because I think we actually have to think much, much harder about this process and try to get away from humans making subjective guesses about what might be right, and then humans making subjective guesses about why what's right is wrong, and instead think about objective criteria that we can consistently apply reproducibly across the questions we want to answer to generate valid evidence. And I think that this is actually the sweet spot of where OHDSI has been and can collaborate together. I think that the solution to building trust in real-world evidence is about building systems that consistently have defined inputs and defined outputs that can be evaluated objectively a priori, so that there is no bias and subjectivity in the process of interpretation. Such a process would basically require that a priori you are deciding on the set of research questions that one is defining, whether it be one question about one exposure and one outcome, or something like what Mark is leading with Legend type 2 diabetes, where we're taking a set of questions to study the comparative safety and effectiveness of diabetes treatments. Whatever the space of research questions are, we need to develop objective criteria to evaluate data quality, to decide on objective pass-fail decision criteria to decide a database is or is not suitable for a particular question. And for those that are suitable, we need to go through an objective process to develop and evaluate phenotypes, to have objective go, no-go decisions about which outcomes and exposures can or cannot be reliably studied across our databases. And for those that pass that, we need to have objective criteria to evaluate the reliability of our analysis. We need to prove that our methods are unbiased, that our methods actually produce operating characteristics that are acceptable. And if they do, only at that point should we be at the point where we are confident in generating results. And so if you are, like me, in a space where you are obligated to write a protocol, I would assert that what I'm describing here isn't necessarily revolutionary. I'm simply saying, instead of writing your protocol at the start of the process, why don't we write the protocol at the end of the process when you're not guessing about what's going to happen with your data, you're not guessing about what's going to happen with your phenotypes, you're not guessing about what's going to happen with your analysis, but instead you have a system that has proven that those elements are going to be sufficient. And at that point, if you have a protocol in place that describes that process, that protocol cannot just be a one-off activity of a meandering path to get to an answer of a question, but actually it can be a standard operating procedure of a system that could be executed faithfully across any range of research questions, whether that be one question of one exposure and one outcome of interest, or whether we were to think about the domain of actually trying to develop an active safety surveillance across all medical products and all adverse events of interest. The point here is that a systematic approach to characterizing data, characterizing diseases, estimating the effects, predicting outcomes for patients is something that we are well equipped to do within this OHDSI community, but only if we bring a lot of the bits and pieces that we have put together as a community and bring them together into a system. Right now, we've got really tremendous work and processes that we are following. But right now we've got, it feels like going up to Catherine's playroom right now, where there's a box of Legos scattered across the ground. I know what somebody could build something good with them, but right now it just hurts my feet every time I walk into her playroom. So I'm going to make a passionate argument that one thing I'd like to work on in 2022 is to think about how we can bring some systems approaches to generate evidence, to learn from the examples that we've previously done in our Legend studies, to continue to support Mark and the team on our Legend type 2 diabetes, but also to extend that even further to think about how we can take a more systematic approach to our open source development and to our clinical evidence generation in everything that we do. Whether that be you're particularly interested in the safety or comparative effectiveness of a particular disease area or particular products, this is something that I think we all could actually collaborate on together. So with that rant aside, I'm also going to highlight a rant from somebody else. Normally, I don't just randomly capture things off of Twitter, but I saw Ken Mandel posted this. I have deep respect for Ken, and I thought that this tweet was actually spot on for what I wanted to talk about here. He posted this just 2 days ago, epidemiology is going to need to get closer to actual real time. This just published JAMA paper measuring the false positive rates of SARS-CoV-2 rapid antigen test presents compelling results, recent data and results, but about the Delta variant. Here's the problem. If we don't have systems in place, we can't be proactive. We can't anticipate questions. We can't deliver answers to questions at the time that they're needed. Instead, we're forced, if we don't have a systematic approach, we're forced to be reactive. We're forced to start our meandering journey of the process at the time that the question's asked. And the problem is at the time that the question's asked, that's when the answer is needed. Now, OHDSI may not be well equipped to answer all of the emerging public health questions that are coming up with SARS-CoV-2, questions about the COVID vaccines. There are some questions I think we can make important contributions to, and other ones we probably can't. But we don't need to be in a pandemic and a public health crisis to think about the urgency of generating evidence that can improve care. I think with Mark's work with Legend type 2 diabetes, if we put the same urgency to type 2 diabetes that we did to COVID-19 over the next year, we could actually impact the lives of millions, much in the same way that the previous work that OHDSI has done in Legend hypertension has that same potential impact. But I would say, to Ken's point here, I think he's absolutely right. It should be a call to action to all of us to be thinking about how we can actually generate evidence that's useful, not just helping to pad our H-index with random papers in a good journal, but actually generate evidence that can actually inform current clinical care. So with that rant aside, I want to briefly summarize how we should accomplish things together in 2022. So many of you are active members of many different work groups, but I see many newcomers on the call, and so I want to highlight that OHDSI at its core, we are a collaboration. We're a team of teams that are all trying to work together and trying to accomplish things of shared interest. We have 27 work groups that were listed out on in our Journey publication. They're all highlighted here. This ranges that scope of open community data standards, open source development, methodologic research, and clinical evidence generation. It spans areas that are kind of core and central to what I just talked about, as well as things that are tangential, but hopefully we'll have a key way to figure in. As long as it is something that is of interest and directly supports the OHDSI mission, we are here to try to support these activities taking place. So work groups, there's a main way that we want to try to work. We can't all do things on a call with 150 people here today chatting, so we need to be able to break up into specific pieces of activities. We've had tremendous success with our work groups up to this point, but I think as we've matured, we've recognized that there's more support needed to help work groups be successful. And so we've established some ground rules for how work groups are going to work starting here in 2022. This is pretty lightweight, but I want to go through it so everybody kind of understands how you all can meaningfully contribute to work that's going on. Work groups are teams created to collaborate on addressing specific scientific process problems necessary to advance OHDSI's mission. So for the work groups that already exist, you all have a virtual workspace that can be used to facilitate workgroup activities. That can include synchronous meetings, which can be held, you saw Craig provide the list of those, as well as asynchronous chats and file shares in our OHDSI Teams environment. What we're asking is that all work groups create an approved objectives and key results document that clearly states what the work group is actually trying to accomplish and what its markers of progress are. And this document should be kept inside the Teams environment so that everybody can actually have access and see those. We're asking that work groups maintain all of their meeting agendas and meeting recordings in the Teams environment, so anybody who misses a meeting can catch up and make sure that they can meaningfully contribute. We'll also be holding this year quarterly work group summits, work group leader summits. So we will have meetings just for the work group leads where we make sure that there's adequate communication that's occurring between work groups. And we're asking that work groups participate in these so that we make sure that we understand how all the bits and pieces fit together. Work groups are going to be asked to provide an update on this community call at least once during the year. And we're going to ask that you provide content so that everybody, including newcomers, really know what you're all about, and so that we can highlight and encourage active contributions. Craig's been working on new webpage material that's out there on OHDSI.org, and we'll give you an orientation to that in a future meeting. Now, I mentioned that all the work groups are going to have objectives and key results. This is something that we introduced last year, and we're going to go back to the well to try to take advantage of this more effectively this year. This is an organizing framework just to try to be clear and communicate exactly what we are trying to achieve. An objective is a goal of what should be achieved, and our key result is supposed to be some specific measurables to benchmark and monitor how to get to the objective. So the objectives are the what's, so this is how we express our goals and intents. They need to be aggressive but realistic, and we want them to be something successful that we can demonstrate clear value to the community. How did we actually advance the mission? Our key results are the hows. These are going to be measurable, tangible outcomes that we can observe, that we can at the end of each quarter be able to assess progress. So we're going to be producing quarterly key results that we're going to monitor to see that we are that all of our work groups are kind of making progress towards this space. Just to illustrate and demonstrate how this will work, since I'm the nominal lead of our OHDSI steering work group, I'm going to be proposing on our next work group call, which takes place this Friday, and anybody who wants to join is encouraged to join, that one of our objectives should be the following. Our objective should be to enable the community to collaboratively generate the evidence and the scientific work products necessary to generate evidence. And that we'll have 3 quarterly key results. These are things to be accomplished in Q1 of this year. The first is that we get 100% of active work groups to have defined OKRs to transparently communicate their activities and encourage contributions. Number 2 is that we intend to convene an OHDSI Work Group Leader Summit to ensure appropriate communications across collaborative activities. And then number 3 is that we plan to release an OHDSI community dashboard to allow for regular monitoring of the health and progress of our community. So as a steering work group, our goal is to enable this community and to support others. For our work groups that are specifically centered on tasks associated with the data standards, you would see more tangible things associated with the OMUP Common Data Model. For work groups associated with open source development, we'd expect to see objectives and key results centered on the delivery and release of software and the use in our community. For activities associated with methodologic research, we're going to see objectives and key results focused on the questions that need to be answered and the release of scientific evidence to support best practices. Whatever the work group, there should be something that everybody can read to clearly understand what the group's trying to achieve. And to try to move it forward with some tangible results that we're going to actively monitor to try to encourage and nudge everybody to move forward. The other thing I want to highlight that we introduced last year, but we know we had a few bumps in the road along the way, OHDSI has released authorship requirements. As a general practice, OHDSI follows the ICMJE guidelines for authorship requirements, which requires that each author make substantial contributions, either to the conception and design of the work, or the acquisition and access to the data, or the analysis, or the interpretation. In addition, they must draft the work or review it critically, and have final approval of the version, and have agreement to be accountable for all aspects of the work. The lead or senior author is the contributor who did the most for the work, and they get to choose whether or not they are the first or the last author of this publication. Some best practices for any collaborative work that's going to ultimately result in publication. If you're thinking that some of your work might result in publication, talk about the publication up front. Before you start writing a paper, make sure that the authors are aware of the authorship guidelines. Make sure that everybody understands what the expectations are. While you're writing the papers, authors can self-identify how they believe they've met the criteria. We've provided a table as a shell for how to actually make sure you monitor and capture this. And when you're submitting a paper, the lead or senior author has the final authority about authorship. Make sure that you're having those discussions up front, not at the end when people can get their feelings hurt. As it relates to all publications, we are an open science community. We encourage publication in ways that make publications open access to whatever extent possible. The lead or senior authors is responsible for any expenses associated with publications. That's out of our jurisdiction there. Now, just a couple minutes left. I want to highlight that we got 2022 is a long year. Seems like each year provides plenty of different opportunities, and sometimes in our community we get or I get a little bit too insular in talking about just what's going on in the OHDSI community, but there's actually a wealth of places where OHDSI collaborators are exchanging ideas and sharing work and works in progress. And so I wanted to highlight this on this schedule activities, highlighting all of the various scientific conferences that I'm aware that members of the OHDSI community are actively participating, when and how they happen. In addition to our Tuesday community calls, which we'll continue to have, Craig did a really spectacular job of leading these last year and will continue to do that this year. We also have our Asia Pacific calls that'll occur every Thursday, every other week. But there are a lot of other scientific and conferences that are opportunities for engagement. I would encourage all of you who are contributing to some scientific work that's presented at some conference, please share that work with this community, and there may be others in the community who are interested and maybe even can contribute and participate, whether that be virtual or actually at the same meeting so you can get together. There's going to be a lot of opportunities for active engagement and collaboration. To Jake's question, yes, we indeed will have a 22 OHDSI symposium. We don't have dates earmarked, but we do hope to communicate that very shortly about when the global symposium will take place. One specific thing I want to, I'm sorry, two more things. Conferences, if you are interested in contributing to various conferences, there are various deadlines that are coming up in the next month. For those who are interested in the user R community, there's a call for tutorials due at the end of the month. JSM abstracts are due first day of February. ISPE abstracts are due February 13th. ML for HC in April. These are just some of the dates. We'll continue to try to monitor and keep track of these dates, but I would encourage anybody who knows that a date's upcoming, please share that with the community, and let's try to make sure that we're supporting each other in getting our work out there. I am announcing that February 2022 is Phenotype February. In February, every day, day 1 through 28, we are going to have a new phenotype that will be developed and evaluated following OHDSI best practices. The daily task is going to be given a phenotype target to create a clinical description, review the prior work, develop a cohort definition using OHDSI tools, evaluate using OHDSI tools, and write a summary of the finding. In 28 days, we will have 28 completed phenotypes that our community can benefit from. I intend to start Phenotype February by leading by example by doing some of this, but if anybody's interested in taking a day in Phenotype February to do your own phenotype, I would encourage you to just reach out to me. I would love to have you participate along this journey, and we'll be really focusing on phenotypes in February. It's going to be kind of central to almost all the work that we're doing, and I think it'll be a good opportunity to make sure that we collectively develop the competency in this space for our entire community and to develop systems that we're thinking about. All right, so with that, I know we only have a couple of minutes left, but I'm going to drag this over on the screen and do, what do I have to do here? All right, so I'm going to share. No. Well, I'm just going to keep it like this because I don't know how to make it bigger. So I'm looking at the responses that I see about what we should accomplish together, and I'd like to highlight these. So, see, many people thought that developing a system might be a good idea. We also had a lot of support for generating dynamic scripts to transcribe EHR data into the OMOP format. Drinking beer and having dance parties after conducting cool research. I don't know why it has to be after. It could be concurrent, but I fully support that one as well. Align OHDSI tools updates to a release schedule for updating to the OMOP CDM version. Certainly harmonizing our systematic activities is a great idea. Take the next step in convincing the field to adopt OHDSI reproducibility methods now that we have a reasonable track record of studies. To build a better bridge between different chapters and regions. I think trying to foster international collaboration is essential this year for us. Developing an open standard computable protocol object that makes pre-specification of design analysis decisions more easily done and more reproducible. To fix the lack of harmonization of procedure vocabularies within the OMOP vocabulary. Empower more clinicians and clinical partners to be involved in our research and identifying experts. Introduce proper versioning for the entire vocabulary releases at Athena and individual concepts. to develop more methods to understand data quality and completeness, to empower, oh, I just read that one, to generate SQL scripts for sites to easily identify differences between vocab versions, strengthen the connection between researchers and data partners. There's a wealth of great ideas here. I'm going to keep this post up, and we'll encourage others to take a look, to vote, and to add your own ideas. What I would encourage you is that all of these ideas are possible. They are just going to take collaboration. So I'd encourage, for those of you who get excited by any of these ideas, to join work groups, contribute meaningfully to actually taking these aspirations and turning them into accomplishments here in 2022. With that, I will stop and turn it back to Craig.